there, second video here. I know I wrote a big list, kind of told you a big list of what my different videos would be relating to children, being a mom, organization, teaching, all of that good stuff. But I also mentioned infertility. So I just thought that I wanted to get this video kind of out there, out of the way, if you will, before I dive into all of that, because this is a really big piece of my life, an important piece of my life. And if this connects with even one person, or if this helps even one person feel like they're not alone in all of their struggles, then that's why I made it. So again, I have everything written down because it is a long history starting in 2016. And there are many things that have happened, and it's obviously I know it all by heart, but sometimes it's easier to just kind of read it off and stop the tears and all that kind of stuff and just kind of read it matter of fact. So to begin, my husband and I were married in 2012, and then at the end of 2015, we decided we wanted to start trying for a family. In January of 2016, we found out we were pregnant, which we very quickly, it was only 1 or 2 cycles that we found out we were pregnant. So that was thrilling, exciting. I started to spot a little bit, but then it would go away and I spotted again. So then I contacted my doctor and they had me do some blood work, and then blood work again a few days later, and the numbers were not increasing. So we went in for a scan and we found out it was an ectopic pregnancy. So with it being ectopic, the pregnancy was in my fallopian tube and was not viable. The baby could not grow in my fallopian tube. So they had to give me some medication to remove the pregnancy safely from my body. So that was obviously a devastating experience, especially like right when you get pregnant for the very first time. You just naturally assume everything's gonna be fine, everything's gonna be great, everything's gonna be easy. You know, my mom had 4 kids, no problem, got pregnant. You know, when she looked at my dad, kind of, that was the joke she always made, and I never thought that this would happen to me, if you will. So fast forward a few months, we got pregnant again. And again, it didn't take that long to get pregnant. So again, we were excited that we were able to get pregnant right away. Everything looked great. Scans, again, we just had an early initial scan like always, and then we had an anatomy scan, and there was no concerns, so there was no reason to do any other scans before then. But at our 20-week anatomy scan, we found out that our daughter had something called CDH, which is a congenital diaphragmatic hernia. So basically her heart, lungs, everything had kind of moved up into her chest cavity because she had a hole in her diaphragm. Basically, it was completely open, and all of her organs and intestines squished up here, up to her heart, and were basically putting pressure on her heart. And at that point, she was still, still kicking, still growing. Everything was good. And it was something that after birth, we would have to have surgery to repair and move everything where it was supposed to go to relieve the pressure on her heart. But it was such a severe situation that they kind of just said, we're going to keep monitoring you and see how things progress. And unfortunately, just a few weeks after that anatomy scan, they could no longer find a heartbeat, and we had lost her. So we had to deliver her in the hospital. And yeah, that was just a really, really awful, horrible, terrible experience. We were not expecting to lose her so quickly. We knew that it could likely happen, that she wasn't going to make it to term, but we just never expected it to happen as quickly as it did. And during that time, I was teaching kindergarten, and it was just really hard because I was clearly showing all of my students, families, everyone knew I was pregnant. Everyone was thrilled for me. And so it was just a really, really hard time. Of course, I took some time off of work, and all of my coworkers and everyone was just wonderful, but it was just a devastating time of our lives. Okay, so then we move forward, and in 2017, so the following year, I got pregnant again. And this pregnancy, unfortunately led to another ectopic pregnancy. And this time, this is another large piece to this. During this time period, my husband's, actually not during this time period, before this time, my husband's father was diagnosed with glioblastoma brain cancer. And when I was in this pregnancy in 2017, this one that was ectopic, this was right when he was dying, basically, like right at the very, very end of his life. And so it was just a really traumatic period. My husband actually rushed me to the emergency room after leaving his bedside because I just was like, I can't come to see your dad. Something's really, really wrong. We knew I was pregnant, but we assumed, again, everything will be fine this time. And so he rushed me into the emergency room. Another backstory, I have a really high pain tolerance, which sounds like, oh, great, you have a high pain tolerance. It's actually not great in medical things because sometimes you can have issues that your body isn't feeling. So I knew I was not in great shape, but I didn't know how bad of shape I was in. They rushed me to the emergency room and just did exploratory surgery because they actually could not see the pregnancy in my fallopian tubes or anything through the scans. They just, had a theory that I was experiencing that because of the amount of pain I was in, and they knew I was pregnant. So they did an exploratory surgery, and when they opened me up, they found that I had internal bleeding, and they had to obviously take care of that and remove my right fallopian tube. Now, had they not done that exploratory surgery, I would have died. I was not in great shape, and so I'm very, very grateful to my doctors for that, doing that, of course, just because they knew my history and they knew about my Crohn's disease and my pain tolerance and all of that. So fast forward home from the hospital, and my husband was called by his mother saying, you guys got to get over here. And on our drive there, he passed away, and we did not make it in time. And again, I know that he would never put that on me, but I just feel so much sadness around that because it was just such a hard time for the two of us with the pregnancy loss, but also he wasn't able to say goodbye to his dad because he was in the emergency room with his wife. So again, a really, really hard time. We're in a much better place now, but this is just a lot of really hard things. Okay, so fast forward to 2018. We started on Clomid, a drug to help with ovulation. And my gyno was like, you don't really know if this is going to do much. We know you have one fallopian tube, so you have a lower chance of conceiving in general. So we just took Clomid, just saying, you know what, let's see if this does anything, see if this helps. And so I took it for 6 months, and which is a long time on Clomid. Clomid makes you a little cuckoo, at least it did for me, and no success. I kept trying, no success, and then we finally decided to call a fertility clinic to get some help because even though I've shown that I can get pregnant, things haven't gone well so far since having the fallopian tube removed. So this is a good story, so hang on. We called a fertility center, and we were supposed to have our initial appointment, and then 2 days before my appointment, we found out I was pregnant with my living daughter. So yeah, so that's a happy ending. So in 2018, we had a live birth with my daughter, but let me actually rewind. So we got pregnant with my daughter through using Clomid, and we went through the pregnancy, but they sent me to maternal fetal medicine because of my previous ectopic pregnancies, the congenital diaphragmatic hernia, pregnancy loss, all of that. So they do a lot of extensive testing and ultrasound scans, everything. So I am one of those people, which I know many, many are, someone who gets very, 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 very ill in pregnancy, which is a bummer also because I've been pregnant 11 times. So I was so sick, the vomiting, the all-day nausea, all-day exhaustion, which I know everyone experiences, but just really, really, really down for the count. Awful. But I'm also a lucky person that, during like week 19, that's when it goes away. I'm not a whole pregnancy sick. person, which I know many people are. So we went to my anatomy scan, and she looked perfect, but my cervix was shortened. Now, again, this is something that they found because, again, they're doing this extensive scan and they're checking everything out, and I had a very shortened cervix, which can lead to preterm labor, which is, of course, not what we want. So because of that, they decided to put me on modified bed rest. And so during that time, I finally started feeling well, and I was like, okay, I'm gonna start working out again and moving and doing stuff. And then they said, just kidding. You need to be on modified bed rest. They put me on progesterone suppositories and modified bed rest. So basically I could go to work and try to sit as much as I could and then go home. Now, we had to make the decision if we wanted to do a cerclage or not. And we have family that's in medicine, and we looked at that kind of the pros and cons, and it wasn't, I think it's called like, it wasn't opening, it was just shortening. So there's something about like funneling or opening that means like, uh-oh, that's happening. That was not happening. And so we decided to not do the cerclage and just have the suppositories and do the modified bed rest. And so I was getting, scans all of the time checking on that, but they decided, just stay on the modified bed rest. And also during this time, we are remodeling a home, because after all these pregnancy losses, we decided to kind of dive into working on a home together, because in our previous home, we had remodeled and really enjoyed that. But then, right after buying the home, we found out, oh, actually you are pregnant, surprise. So my husband's spending most of his time remodeling our home. I'm living with my mother-in-law and on modified bed rest, not really able to do a whole lot. And it was just a really strange time, and also a really scary time, because we were worried that at any point we could lose her. So, but again, this ends well. So fast forward, we move in 2 weeks before my due date to our home. Yay. And my daughter's still snug as a bug in a rug in there. No moving. And I deliver. But get this, after being on modified bed rest, we ended up having to be induced. Now, they wanted me to be induced because I have Crohn's disease, so I was induced 6 or 7 days before her due date, but I had to be induced. And she, drum roll please, 9 pounds, 11 ounces, 22.5 inches long. This girl was huge. She was never in any danger, even though, of course, I appreciate the care that they were given, and they thought, if her cervix shortens enough that she could go in for preterm labor, so they were doing everything by the book, which obviously was worth it. But during the delivery, I had a vaginal birth, but during the delivery, she was lodged in the birth canal and experienced shoulder dystocia, which is a very scary thing, but everything turned out okay. My doctor maneuvered her very, very quickly and safely, and everything was fine with that. And then, so live birth, everything awesome. I've got my 6-year-old daughter. So let's move forward to 2019. I had an early miscarriage at about 8 weeks, which again, it sounds like, oh, just another one. But at that point, my doctors kind of just chalked it up to, okay, yeah, everyone at that age, has at least one miscarriage, no big deal. So then we moved to 2020, and I had another miscarriage, which was, oh wait, did I? 20? Yes, no, okay, sorry. And then 2020, I had another early miscarriage, but we thought it was possibly ectopic. I ended up being in the hospital for it, but again, there was nothing that came through on the scan, so they're wondering if it worked its way out, but was still a miscarriage. But I had some really severe pain with that and had to be hospitalized. But okay, so then in 2020, after these 2 miscarriages and after, the issues with the fallopian tube, and we still weren't getting pregnant and keeping a pregnancy, we decided to actually go to that fertility clinic that we initially we're going to have that initial consult with, but then found out we were pregnant with my daughter. So we went to the consult, but this is 2020, so we sat right here for that consult via video chat and talked through my previous losses. Of course, this is again why I have it all written down, because I've had this for years, because it's like I need to share every piece of this information with them. And so we walked through possible scenarios, obviously the Clomid, talked about IUI, IVF, all of that. And they decided and we agreed that IVF was the best route. So in the summer of 2020, it kind of started, I think in April was our initial consult of 2020, but then we did an egg retrieval, and which I will say, people can disagree with me, and I apologize if this offends anyone. The drugs from the egg retrieval did not even remotely make me as crazy as Clomid did. Clomid, it really messed with me. But anyways, so we went through the egg retrieval. We were successful. We had a few hiccups because I am a quick stimmer, if that makes sense to anyone here. I respond very quickly, too quickly, if you will, to the IVF medication. So they kind of just gave me a standard protocol, and my eggs started growing too quickly, and enough of them were not able to kind of mature that like at the rate they wanted them to. And so I think they were saying I could have ended up with more embryos than I did. But anyways, I had the egg retrieval. I don't even remember, I'm sorry, the number of eggs that were retrieved, fertilized, and all of that good stuff. But we ended up with 4 embryos. But this is where it got a little crazy. So everyone now, the goal, I don't know, 2025 is, day 5 embryos. You want to get day 5, day 6 embryos, grow them to that point. Yes. So on day 2, my clinic called me and said, hey, your embryos aren't looking great. We need to transfer today. I was like, what? I didn't even know day 2 was a thing. Now, doing all of my doctor Googling, I was like, okay, it is a thing. So they're like, okay, we're going to transfer 2 embryos today. Come, for a fresh transfer. We're like, okay. I'm sobbing the whole way there, the whole way home. Like, there's no way this is going to work. This isn't like a thing. The whole plan was to grow them to day 5, and they're telling me day 2, like they're not even looking good. So did the transfer, had 2 more embryos that they froze as day 2 embryos, because again, they didn't want to grow them to day 5 because they weren't looking good. Did the transfer, fast forward, success. I have my 3-year-old daughter, and fresh transfer of the 2 day 2 embryos worked. I did not have to go on bed rest because we found out that my short cervix is just short. It doesn't open. It doesn't get too short. It's just short. So everything with that pregnancy was beautiful, wonderful, no problems, no complications. It was a dream. And she also was a dream as a baby, like a dream. My oldest had something called FPIES, which is a food allergies, and she had colic, and it was really, really rocky. Now she's the best kid in the world, but my 3-year-old, easiest baby on the planet. Anyways, now we're going to move. So that was a live birth in 2021. Now, this is where it gets really, really rough and kind of where we're at right now. So in 2022, we decided to do another transfer with those remaining 2 embryos. And we had a great transfer. Everything was awesome. No problems. Took all good. And then we did the anatomy scan. And at that anatomy scan, we did not find a heartbeat. So that it was shocking. I was experiencing no symptoms whatsoever. This sounds terrible. My husband's fabulous, but we obviously had 2 little kids. He had the kids and I went to the scan. I was going to video chat with him. It was a situation where, of course he wants to go, but with my previous history, we have so many scans. So he had been to another scan earlier on. I think it was at 17 weeks he had been to that one. So I was like, I'll just go. Like, everything's fine. Everything's good. We already know she is looking good. So we went to that 20-week scan at MFM. maternal fetal medicine, because that's kind of, they send you over there just for everything until the end, even though I didn't have any problems up to that point. And so they went to the scan and there was no heartbeat. There was really no explanation. I also, just to explain a little bit further, we always do the early genetic testing, everything, not on the embryos, but we always do like that early blood test that you can find out the sex and find out if they have any issues, basically. All of that came back completely normal, and they always have for all of our births, so, or for all of our pregnancies, if you will. So it was a nightmare. So I will say the hardest part about this one, that it just like haunts me still. My oldest was she 4? Yeah, she was 4. So she fully knew what was going on. She knew we were pregnant. She was, I mean, both kiddos did, but she really knew. She was so excited. So basically after that scan, I came home and had to tell her that, you know, we lost the baby. And that was, I think through all of this, that was my hardest moment, was seeing her little face. Just, she was just didn't like she didn't understand. And she wasn't born when she lost, when we lost her grandpa. So she's never experienced any death. She's never experienced she's 4. She's never experienced any like real true sadness or loss in her entire life. And my daughter is a big feeler. She just is such a emotionally intelligent kiddo. She just feels so deeply. She feels other people's pain. So it was really, really, really hard. So we just kind of had to drop that on her, and then drove her and her sister over to her grandma's house. My husband's mom lives like 30 minutes away. So she's a saint. And she took the kiddos, and then I'm the kind of person that they were like, do you want to wait a couple days, or do you want to go to labor and delivery now? Do you want to? And I'm just like, I just need to move forward and start processing what's going on. So again, we've already done this with our loss, our 20 week, well, it was more like 22 in 2016. We've already done this, but again, like I said earlier, I don't want to say one thing, this was easy, this was hard, but once you have a child and then you lose a child, it personally crushed me so much more, because I know what you get. I know what you get in the end, and it's such a prize. And once having a child, it was just so much harder. And any of you out there who know someone who has said to you, well, at least you have 2, or at least you have 1 healthy child at home, please stop saying that. Please tell people to stop saying that. That is so hurtful. It is so hurtful. That's not how it works. Like, it's not just like, oh, I have a kid at home, so it's fine. No, it's so hard. It's so painful. And it doesn't get easier because you have children at home. I believe it's harder. Anyways, just sorry for that little tidbit. So we went and we delivered her. Again, labor and delivery, you get sent to this really super sad part of the hospital, and labor delivery, and it's a very quiet area. The other part, it's like this little, they take you down this little wing. It's like the stillbirth wing, basically, where you're going to deliver babies that don't cry. So we delivered her, and she had 2 true knots in her umbilical cord. So they believe that was what caused her death. This time around, because we had 2 children at this point that have died, more than halfway through a pregnancy, we did an autopsy. And also to go backwards, with our first late-term loss, we did an amniocentesis, and that showed no genetic concerns, just FYI. So we did an autopsy, and this found no genetic component. All of our early testing obviously showed no genetic component. So the finding was, it was because of these 2 knots in the umbilical cord. So my understanding is that is something that can very rarely happen, but death, usually only occurs when this happens way later in a pregnancy, when there's no room for the baby in there and they can really knot themselves up. So this was just really hard to wrap your head around, and just kind of, yeah, it just was like a freak fluke thing that happened. And so after that, move forward, you know, I talked to my OB, I talked to the fertility doctors, and the explanation is basically like, Bethany, this was such a fluke. This will never happen again. This is not something that you can prevent or something that you did or didn't do that caused this. It's just like a freak thing. So, although you all probably think I'm a little bit cuckoo, we decided to do, because we were out of embryos, we decided to do another round of IVF at this point. So we did another egg retrieval, and then we did another fresh transfer but this time we grew my embryos to day 5 and 6. And I again ended up with 4 embryos. So we did a fresh transfer and we transferred 2 embryos, and that resulted in, I believe it ended up being, it was such like a back and forth to the ultrasound every few days. My numbers never looked good. What is it? Why can't I think of the name of the, like this certain level is supposed to grow, and I'm having a brain freeze right now, but this is really going to bug me. But this certain level is supposed to grow. It's like the pregnancy hormone is supposed to keep growing. And from the very beginning, the number started a little bit lower than I've ever had it. And it was growing, but not really, really well. And then we went to the first scan and there was a heartbeat, but baby wasn't growing as well as it should. And so we kept having scan. And then finally, by 9 weeks, heartbeat stopped. And then the testing found, it was I can't remember, it's like trisomy something, where it was just basically like it's going to end in a miscarriage every time kind of deal. Again, I'm sorry if I didn't explain that very well. But then, fast forward, so that was 2023. Fast forward to 2024, we decided to transfer those remaining 2 embryos. Success. And also, all of these pregnancies, we were able to find the sex almost in every single pregnancy, because it got far enough where we would do that early blood test. Girl. Only girls. So we did the genetic testing, or the early blood test, for this 2024 pregnancy from those remaining 2 embryos. And we could not, I've never been so shocked in my life when I saw those blood test results. We were pregnant with a boy. Same deal as I've explained before. Go to my gyno, or my OB, I keep saying gyno. Go to my OB first, which is also my gynecologist. And then they quickly send you over to MFM because of my very, very, very extensive history. Sorry, I was just thinking, it was like we go to MFM, scan after scan after scan. Everything's beautiful. Everything's great. No problems. So thrilled. I had gone to a 15-week scan. Maybe it was like 15 and a half, but they basically were able to do an anatomy scan that early because of the type of technology they have at these specialists. They're able to just see things, not everything, but she was able to get like a really good view of heart, lungs. You know, I always ask, like, is the diaphragm there? Because of our history from, you know, a long time ago, just making sure everything's where it should be, baby's growing as he should, everything. Yes. So that looked really, really good. So then fast forward to, it was 17 and a half, maybe 18 week scan, another anatomy scan to basically get everything they hadn't gotten, which was just a few things. I will never forget this scan, which again, I have so many moments of I'll never forget, where your heart drops into your butt and you can't breathe and you're crying, and it's just like, you're like, is this you like your brain, you go outside of your body, you're like, is this really happening? Like, this can't actually be happening. So this time we're scanning and I'm just talking to the ultrasound tech. She's so lovely. And I'm like, yeah, you know, like, this is just so grateful that, like, finally, you know, things are going right after so many problems. I've got a little boy. Like, we're so excited. We can't wait. We haven't told the kids yet because, you know, with what things have happened previously when we lost Emmy, the loss that happened after, you know, my daughters were born, that whole thing I explained, you know, like, we want to wait until almost third trimester if we can to just share with the girls, because it was just so heartbreaking to share that really hard news last time. So anyways, we're going through everything, looks great. She's measuring, everything's awesome. She's like, great, yeah, he's a grown boy. He's right on track. Everything's perfect. I found everything I need to. And then she goes over the heart. And I'm sitting there and I'm like, what's happening? She keeps going over the heart. And I hear, she's like, oh, no, this is what happened. She goes, do you want to hear the heartbeat? I'm like, yeah. So she did it and we saw it and she was like, oh yeah, that looks great. She goes, but then, oh, I forgot to turn the sound on. So then I hear it and it's like super duper slow. And I'm like, what is happening? And she says nothing. And I'm like, that doesn't sound right. I'm like, okay, she just told me the heart. It was great. And she said the number and everything's good. But then this is where I was like, oh no, yeah, I've been here, done this before, where she's scanning and scanning and scanning and rescanning. I'm like, oh, we're going to have some sort of like a heart defect. Like, and I'm in my head, like, you know what? It's going to be fine. Like, it's okay. We've been through so much. Like, I'm just so grateful he's here and he's healthy and we're going to figure it out once he's born. And he's probably going to have surgeries. Like, this was happening in my brain. So at least 50 minutes passed with her doing a transvaginal, which I've had hundreds of them, no biggie to me, but I'm like, oh no, why is this taking so long? So she does it over and over and over and over again. And she just finally stops and is like, hey, I need to go talk to the doctor. Things aren't looking like they should. So I'm like, oh, okay. So then she doesn't come back. The doctor comes back and I'm like, oh no, this is the worst, because I mean, you guys all know that if the doctor comes, that is not looking good. So the doctor comes in and she says, this is making me cry. She says, Bethany, I'm really worried about your baby. I'm really worried. And I'm like, what? Like, he's in there. He wasn't really moving much, but I just figured, okay, he's kind of just laying in this certain spot. She's like, I'm just really worried about your baby. There's like a mass by the umbilical cord. I'm not totally sure what it is, but the ultrasound tech was scanning you for over an hour and the heart rate is there always, but it just dips way down and then it comes up. Then it dips way down and then it comes up. And she's like, and so I'm just sitting there like, what? Like, are you kidding me? Like, what? Okay, sorry, I'll get it together. And so again, I just keep dealing with the nicest humans on the planet. And again, I'm alone because I'm an idiot. My best friend said, I'll come with you. And I'm like, no, like, I just had a scan 2 weeks ago. My husband's got to work. Kiddos are at grandma's in school, or I don't know where they were at the time. Anyways, I'm fine. Like, I know everything's fine. But again, nothing ever seems to be fine for me. So I should not have been okay with that. Anyways, Margaret, if you're listening, I know you offered and I shouldn't have been alone. Anyways, she just is like, Bethany, this isn't looking good. So I'm like, well, what do we do? Like, well, how do we fix him? Like, what? And she just looks at me and she's like, there's nothing we can do. She's like, we can try a few things. I'm going to do some research. She says, I've never seen anything like this before. I've already talked to all the doctors in our practice. No one has ever seen anything like this before. This like mass with the entire scan is perfect. The heart looks perfect. He looks perfect. But his heart rate just keeps dropping. And there's some sort of a mass in the umbilical cord or like around the umbilical cord, like swelling. She's like, I don't know. I don't know what it is. So she puts me on Plaquenil and Lovenox. Now, I don't really know the explanation of Lovenox, but Plaquenil is like a blood